This throat looks perfectly healthy, but in 18 hours, swallowing a sip of water will be nearly impossible. This is a strep infection, observed hour by hour, from deep inside the tonsils, a war in miniature. These aren't useless leftovers. The tonsils are the first checkpoint guarding your airway against invaders.
Deep folds line each tonsil, dramatically expanding the surface where the immune system samples everything that passes. With every breath, air washes across this surface, and each particle is tasted for potential threats. Hour 0. A single Streptococcus pyogenes lands, and everything is about to change. Fine surface proteins anchor into the tissue wall, gripping tight so no current can wash the invader away. It splits town, 1 into 2, 2 into 4. Every 20 minutes, the colony doubles. Hour 1. The lining cells detect the intruder and fire chemical alarms, one triggering the next. These are cytokines invade, a distress call broadcast through the tissue with an address attached. Hour 2. Blood surges to the front line and the tissue floods deep crimson. An engorged vessel presses against the nerves beside it. This pressure is where pain begins. Hour 3. The barrier turns deliberately leaky, loosening its own seams to let fluid through. Hour 4. Fluid floods the tissue, and the tonsil swells outward from the inside. Also at hour 4, the demolition crew arrives. Neutrophils squeeze through the wall gaps.
It engulfs the bacteria, then floods the area with destructive chemicals, parrot, a violent, close-range counterattack.
But here's the trade. Those same chemicals kill bacteria and scorch your own tissue in the process. Collateral damage is unavoidable.
Hour 6. The first symptom you actually feel, Tos. A faint scratch when you swallow.
Hour 8. Dead neutrophils, dead bacteria, and cellular debris begin collecting deep inside the tonsil crypts.
Pull back, and the collection has a name you'd recognize instantly from your own bathroom mirror.
But here's the key insight. Those white patches aren't the infection itself. They're the wreckage of the fight, the aftermath of your immune system's battle against the invaders.
Hour 10. Cytokines enter the bloodstream, surging upward toward the base of the brain.
They reach the hypothalamus, the small region at the base of the brain that holds the body's core temperature setting, its internal thermostat.
The needle sweeps from 37 to 39. The body isn't overheating. In fact, it's obeying a new target. You shiver because your body now believes it's too cold, forcing muscles to contract and generate heat.
Fever is a weapon. Heat slows the bacteria while your immune cells move faster and hit harder.
Hour 12. Swollen tissue presses against nerve endings packed densely into the throat wall.
This is the glossopharyngeal nerve. It carries signals from your throat, but it also serves your ear along the very same pathway.
The brain can't tell which branch fired, so a throat infection makes your ear ache too.
Hour 15. Immune cells drain into lymph nodes beneath the jaw, which swell and turn tender.
Hour 18. The fork. From here, two very different outcomes lie ahead, and the body must choose one.
Left path. The immune system wins. Signals fade, the swelling settles, and the tissue calms.
Now you sweat, because your body is genuinely too hot. The target resets to normal.
Over 3 to 5 days, the surface rebuilds. Crypts clear, craters fill, and health returns. But the right path is darker. The infection breaks through the capsule wall into the tissue beyond. Pus now collects behind the capsule, swelling into a dangerous pocket, a paratonsillar abscess.
As the abscess inflates, it shoves the tonsil across the midline. The airway narrows on one side only.
The muscles that open the jaw go into spasm. Now even opening your mouth becomes difficult.
Make no mistake, This does not resolve on its own. An abscess like this needs to be physically drained. But before we get to the warning signs, there's one thing almost nobody tells you about sore throats.
Most sore throats aren't bacterial at all. They're viral tussies, and inside, they look completely different.
A viral throat usually looks diffusely red and evenly inflamed, smooth all over, typically without the white patches.
Antibiotics kill bacteria, but a virus has no cell wall to attack tos, so they do nothing here.
Viral usually brings cough and a runny nose. Bacterial brings white patches, fever, and swollen glands, usually without a cough. In adults, the overwhelming majority of sore throats are viral. In children, the bacterial share is meaningfully higher.
Viral sore throats resolve on their own with rest and fluids. No prescription changes the course.
Whichever kind you have, these signals separate a bad week from an emergency. Watch for 4 of them. Signal 1, pain that's clearly worse on one side, not both. Asymmetry is the warning. Signal 2, difficulty opening your mouth. When the jaw won't fully open, take it seriously. Signal 3, a muffled, thickened voice. When speech sounds smothered, the swelling is advancing.
Signal 4, trouble breathing or drooling because swallowing has become impossible.
That last one isn't a morning appointment. That's an emergency room, right now. Now let me step out of the animation for a moment and tell you what it gets wrong. The white patches frighten people most. In practice, they tell you almost nothing about how sick someone actually is. I've seen dramatic tonsils in someone who felt fine, and nearly clean ones in someone needing drainage that same day. What actually changes my decision is asymmetry, and whether the jaw opens, far more than anything a phone light reveals. Here's the reassurance. Most tonsillitis is not dangerous, and most sore throats aren't even bacterial. The point of knowing the mechanism isn't fear. It's knowing which day is the day you stop waiting. So this is where we end, where we began. A healthy throat. Calm, symmetrical, whole. Take care of yourself, and check the full playlist for more like this. Thanks for watching.